So today we're going to talk about liposuction. This is our fifth most popular cosmetic procedure in our practice. We do this all the time. It's one of the most common things we do in our practice. And I've been doing this for 15 years now. Okay, when we talk about celebrities, what do we notice about celebrities? Can anybody come up with some common traits that we have with our celebrities? What? Their bodies are usually great, and what about their faces? They're attractive. So celebrities take time to work on how they look. And you know, some people call this superficial, but you know, there's a lot of evidence to show that we're programmed to be more attracted to people that look good. And you know, the theory is it dates back to our primal instincts that we're really looking for people to pass on our genetic material to. And so people that are more fit and more attractive are probably better candidates for transmitting our genes on, you know, for longevity. And so you can see, you know, these are some of our most popular celebrities in our country. We all know these faces and we all know the bodies. Now, some celebrities say that they don't care, but in our society, you get ridiculed for this, or not necessarily ridiculed, but you'll get written up in different publications when you get out of shape. And then, you know, we have Kirstie Alley, who people start criticizing her. She goes on a diet. She looks terrific. And then we have Tyra Banks here, who says she doesn't care, but, you know, 2 months later, she's skinny again. So, as I mentioned, you know, there is an ideal shape that we have programmed in our minds that is considered ideal. And for women, it's the hourglass figure where their waist is smaller than their hips and their breasts. And men, their waist is smaller than their shoulders. So for women, it's the hourglass figure. For men, it's the V-shaped figure. Okay, and so what's been going on in America, you all have seen this slide before, I'm sure, but this was back in 1989, and you can see that very few areas in the country had a huge percentage of obese people. This is greater than 30%. In most places, it was less than 10%. And you fast forward to 2010, and you can see a huge part of the population is now overweight or obese. And so almost 65% of Americans are overweight or obese, 31% are obese. And that doesn't mean you're heavy, that means you're obese and it's affecting your health. Let's see, 33% of adult women are obese compared to 28% of men, so there's a higher percentage of women that are obese. 8 out of 10 people over 25 are overweight. And this is alarming to me. And 78%, and one of the reasons is 78% of Americans are not meeting their basic metabolic levels, so they're not getting enough activity. And we all know that people are spending more time inside on watching TV, playing with their computers. And then 25%, a quarter of Americans are completely sedentary. That means they get no exercise. Jessica. Okay. So, you know, and some people say, well, I don't mind, it makes me feel healthier, I feel better about myself, you know, when I have a little bit extra weight. Well, I think a lot of people may say that, but the reality of that is I get on all of you about your diets, right? You know I'm fanatical about getting on everybody about their diet. And the real big reason is not only are you going to feel better, but there are some serious health issues that arise from not eating a healthy diet and not maintaining a proper weight. So you can get high cholesterol, high triglycerides, diabetes type 2, high blood pressure, the metabolic syndrome, which is a combination of all the above, diabetes, high blood pressure, and high cholesterol. And this is serious stuff because this leads to heart disease, heart attacks, strokes. Have you ever seen anybody who has a stroke? I mean, do you ever want that to be you? Where you can't take care of yourself and you hobble around and you can't. Some of our patients can't even speak because it affects the speech center of their brain. So this is really serious stuff. And you say, oh, this isn't going to happen to me. Well, guess what? When I was 20 pounds heavier than I am now, I had high blood pressure and high cholesterol, and I was in my 30s. So, you know, this happens to everyone that doesn't control their weight, or a huge percentage. And you can also have an increased risk of cancer. Who wants to get cancer? Sleep apnea, which is difficulty sleeping, depression, gallbladder disease. It can affect fertility. So if you're very overweight, you can't get pregnant as easily. Non-fatty alcohol liver disease, so your liver becomes gets fatty and diseased, and skin problems. So, and we all recognize this problem, and this is not a secret. I mean, I think President Obama's wife is a big one on this. Isn't that one of her causes, is obesity? And you can see we have shows like the Biggest Loser to try to help people get this under control. And this is the shape that people are going for. And if you look, it's just, we're programmed. And I tell the story about how babies, even infants, will look at pictures and their attention is focused more on attractive people and in shape people than on less attractive and less in shape people. And this is scientifically proven. So we're programmed from the get-go to find people that are more attractive and more fit to be more pleasurable to look at. And did I mention that and we have endorphin release when we look at attractive people? And they say that may be one of the reasons that people become stalkers, because they get this endorphin rush from looking at attractive, fit, beautiful people. Okay, so the cause, this really isn't rocket science. I mean, we all know that it's an energy imbalance, so we become heavier when we put in more calories than we burn in a day. Is that a shocker to anybody? Does anybody not know that? I think one thing that's gone on in America that's led to this, though, is that we've gone away from this concept. The concept today is that if you eat the right food, if you cut out all your what's the fad one? If you only eat protein, you're going to get skinny. It doesn't matter how many or how many calories you get in protein, as long as it's pure protein and you have 0 carbs. And then they'll do the other thing where, you can't have any fat in your diet and then you'll lose weight, or, there are all these crazy things, but it's really, a lot of it is just calorie balance. And so, since we know this, it should be simple, right? We now know that, okay, everybody can go home and you're never going to have a weight issue again, right? Because you now know that if you eat the right amount of calories, you're going to be fit. But it's really not so easy, because otherwise everybody would be fit and thin. Because they do the thing where they have people that are thin carry around 50 extra pounds. They put these weights on you, and you really feel different if you're carrying a lot of weight around than if you're carrying the right amount of weight around. So, and here you can see that this, I think, is really a nice slide, because to me it speaks on why this can be so important: fitness and being the right weight. What would you say about this girl if you were a meet her? What characteristics would you think she would have? She would be more confident. She looks like she's ready to engage with you. She looks like she's she just looks like a girl who's got her life under control, to me. And I think it sort of represents, her thing represents that. Now, liposuction can help us get closer to where we want to be. It's not a cure for your overall health, but how we look on the outside is an indication of our health, how we feel about ourselves, and how we take care of ourselves. So when people do liposuction, oftentimes it's a motivator for them, and it will help improve your self-esteem and self-confidence as well. So we talked about this earlier. It was the #2 most popular cosmetic procedure. This year, I think chin implants sort of popped up there to #1. Wasn't even on the list before. And I always like to talk about this. These are the big procedures. Botox, 2.5 million procedures done. Laser hair removal, 1.3 million. Hyaluronic acid, which is Restylane, Perlane, 1.3 million. Compare this to the surgical procedures. Breast augmentations, 356 versus 2.5 million injections. So when we look at these things, guess what? These are all performed, and the research and most all of the data that's collected on this stuff is done by dermatologists. And so dermatologists really are the new face of cosmetic surgery, so we should be really proud of our heritage here. So with liposuction, we can go from this to this with one treatment in the matter of a month or two. And for men, we can go to more of the V-shaped pattern in just a matter of a month or two. A liposuction, the first case reported of liposuction was in 1921 by a French surgeon, and what he did was he had a ballerina and she wanted to have skinnier knees, so he curetted them. Unfortunately, she died. So, in 1990, things changed a lot, because Jeffrey Klein, a dermatologist, created an anesthetic that was basically comprised of water, a little bit of lidocaine to numb up the area, a little bit of epinephrine to constrict the blood vessels, and a little bit of sodium bicarb, which cut down on the stinging and burning when you inject this. So this is Tumescent Anesthesia, and this is what makes dermatologists special, because this is what we use to numb people when we do liposuction. So it's got 3 basic advantages. You have reduced risk, reduced cost, and also we have a quick recovery time. So why reduce risk? Well, there's no general anesthesia. It really reduced the amount of bleeding you see with this procedure, basically to almost zero. It cuts down on the risk of thromboembolism, and that's clots that are thrown that can kill people. And the reason for this is during this procedure, you're not laying there still, because if you're laying still, that increases your risk of having clots. And then it also decreases your risk of having perforation of vital organs. And the reason for this is you still are awake, you still do feel things when you go deep. Reduced cost, no anesthesia, no surgical suite fee. And then we also have, one of the things that I love is we have the ability to build a relationship. And then you also have the quick recovery time because you don't have the hangover from the anesthesia, number one. Number two, you don't have, it's not probably as aggressive because we don't tear muscles or do anything like that. So you're up and about within a couple days. And this data I think is really telling. You can see early on in '88 there were 0 deaths with derm. Again, 0 deaths with derm. If you look at the other ones, there are deaths associated with this procedure. And again, as late as 2002 with 65,000 patients, 0 deaths. And I haven't seen any literature. I just read an article about this, and it still supports the fact that dermatologists with Tumescent Anesthesia have had 0 deaths doing liposuction. Now that's a pretty impressive statistic. Okay, so why are we better than everybody else? Yes, but there are some other factors that come into play as well. So with plastic surgeons and other people, they're doing several procedures in the same session. Oftentimes they're doing liposuction as well as a tummy tuck, or a tummy tuck and a facelift, or breast augmentation, tummy tuck, facelift, all at one time. So they've got longer operating hours. They're doing mega liposuction. They're administering a lot of IV fluids. They have high doses of lidocaine in combination with general anesthesia. So why does fat matter? We talked about why the fat matters a couple weeks ago. Why does it matter besides for liposuction? Do you remember, Andre? Yeah, why does fat matter? Does anybody remember we just had a lecture about it recently for facial fillers, and having the right amount of fat in the right places makes you look more attractive in your face as well as your body. So, but fat matters because it's an energy storage for our body. Okay, and with fat cells, a lot of people think that you just keep growing fat cells, but in reality, in most situations, fat cells are like elastic balloons. And when you gain weight, the balloon gets bigger. When you lose weight, the balloon gets smaller. And we've always thought that there's a fixed number of fat cells in our body. However, now we realize with obesity, and we're seeing more and more of it, 30% of Americans are obese now, that you actually do get more fat cells if you gain a lot of weight. And women have a higher percentage of body fat than men. Sorry about that, ladies. So women just collect it in different patterns than men do. For women, they tend to collect it in a gynoid distribution, which is a pear shape, and men tend to collect it around the middle, which is the beer belly pattern. Okay, so the idea with this, and a lot of people don't understand this concept, is we have extra fat in certain areas. So this is the android distribution around the waist. And so what we want to do is we want to decrease, you can see there are more fat cells here than there are up in the back. So we want to get an even distribution of fat cells. So we shave this off, and this is an actual patient here where we shaved off some of the excess fat. And the idea then is that when you gain weight, you gain weight evenly throughout the body. So it doesn't go somewhere else. The fat cells just, because you have the same number of fat cells here as here, now they expand and contract at the same rate. Does that make sense? Okay. So 2 layers of fat. We want to focus liposuction on the deeper layer of the fat, because if you go too superficially, you can see contour irregularities because it leads to scarring, and you'll see some pictures of that, which is not attractive. But in some situations, we do superficial liposuction, for example, underneath the chin, where we want to get enhanced adhesion. So what we're doing is we've got fat cells with connective tissue. And up here we have the skin, and down here we have the muscle. So we've got connective tissue attaching the skin to the underlying muscle. And what we want to do is we want to suck the fat away from this connective tissue, because the connective tissue is elastic. And so it's like a rubber band. If we get rid of those fat cells, it's going to contract and shrink, and it's going to make it so the skin doesn't sag and bag. So we don't want to do a lot of disruption of this, fragmenting this, because otherwise it won't be elastic and it won't shrink down. Okay, so the analogy is you've got the skin up here, you've got the muscle down here. The grapes are the fat cells, the grapevine is the connective tissue. We want to leave the connective tissue intact so that the skin will retract. And so maximum contraction typically takes about 4 months. The overall wound healing will take approximately 18 months. So when we have patients come in for a consultation, what we want to do is we want to make sure that we're not getting poor candidates, because we want people to come out of here being happy. Because guess what? Word of mouth is how we build our practice. So we don't want to have people who have unrealistic expectations. You have, and this is huge, you know, with liposuction. Liposuction is a great procedure, but guess what? Most of the people that we take care of, 25% of Americans are completely sedentary. And a lot of the people that come for liposuction are in that category. So they don't have any muscle tone, they don't have healthy diets. And so we're going to get them to look better, we're going to shrink them down in their clothes, but is it going to be perfect? No. I mean, they have to do some major lifestyle changes in order to get that perfect body. So they have to understand that this is going to trim them down, they're going to look better in their clothes, but it's not going to transform their body so they're going to have tight washboard abs or anything like that. Also, if you have patients that have been to lots of different physicians and they're unhappy with each physician, we've all met those people. The minute I talk to them in a consult, I'm like, you know, I'm not the doctor for you either, because when I was younger, I used to think I had a magic, I had a charisma about me that could win people over, but you just can't win everybody over, unfortunately. And body dysmorphic, those are the people that are obsessed with one thing, you know, and you fix it and they're still obsessed with one thing. I see it with filler people all the time. They have this one area they want filled and their face is starting to become distorted, and they still want more filler in that area. So consultation, you guys have all heard us talk about this all the time. We want to have a positive contact. We want to, you know, be friendly with our patients. But the most important thing in a consultation is to explore and listen to what people's concerns are. Because you want to get your rap going really fast because you've got a lot to say about how great we are. But maybe they don't really want to hear that. They have specific questions that they want addressed. And everyone has a specific question that they want addressed. So we want to hear them before we start giving them our talk about how great we are and what we can achieve. And I think it's important to talk about a potential for a touch-up, because with people today, like I said, we're not getting the people. So I love it when we get somebody who's a bodybuilder or, you know, a nutritionist or something like that, and they have that just little collection of fat. But for most of our patients, they're using this as a technique to look better, and so they're not starting at a great place. So for most people, there's a possibility of a touch-up, because we're debulking with the initial procedure and then we're fine-tuning. And it becomes a little bit more difficult the more procedures you have done, because there's more scar tissue in there. And it's always, always, always important to do a response check, and that's to make sure that our patients, we've addressed our patients' questions. Because you can talk and you think you've given them the best consultation you've ever had, and they didn't hear a word you said. Right, LaRue? Yes. Yes. Okay. So frequently asked questions: how much weight will be lost? Lawrence, how much weight's going to be lost?
Maximum, probably about 4 to 5 pounds.
But typically it's inches and not pounds. And people will actually gain some weight initially after the procedure because of the fluid that we infuse. Will the fat cells grow back, Lee Belamonte? No, they don't grow back. Do the fat cells go somewhere else? No. And what's the recovery time? Typically, I say a couple days relaxation, and then you can get back to work. Now, I had mine done one day, I went back to work the next day. So there's not a lot of downtime with this procedure. Tiny little scars, and will there be hanging skin? This is all going to depend on how good your elastic fibers are, how good your connective tissue is, and we'll give some examples of that in a minute. So you can see here, this lady actually had a pannus. That's that apron hanging over. And guess what? This is still within a month. You can see her sign of having her compression garment. A little bit of dimpling here, but that's within a month. And guess what? She had good connective tissue. You can see she's tight. Disappeared, completely gone. Okay, so we want to know a little bit about their past medical history. We want to make sure they're appropriate candidates. The Donde West law, you know, Kanye West's mom died when she was having a tummy tuck. Was it tummy tuck and breast dog or tummy tuck? Liposuction and tummy tuck. And so we want to make sure that they're appropriate candidates. The nice thing with Tumescent Anesthesia is most people are pretty good candidates. We want to make sure that they don't have previous surgery. We want to check on their previous surgeries and hernias. Most of the complications medically are really basic: bruising and swelling. Nothing really too serious. And then we can get contour irregularities and tiny little scars as well. So this is where I was telling you, this is not our patient, but you can see how dimply he is. And this is from doing liposuction in a superficial plane. And to me, this is kind of classic for what is easy to achieve using the laser lipo cases. Okay, because you go too superficially, so you suck fat here, you leave a little bit here, you suck too superficially, so it gets these scars, and so it leads to this. So we want to do a physical exam on our patients. Big things to know are weight gain. 99% of people who aren't happy with their liposuction, guess what's going on? What do you think happened, Angela, with these people? They gained weight. So they come back, they say it didn't work, and 99% of them, they gained weight. Because on average, people gain weight every year of their life. That's why I get nervous for the young people in our office that gain weight, because if you continue that trend, you'll be huge. We'll have to get bigger doors. Okay, so we also want to measure patients because this is important because it's inches, not pounds. We want to do the pinch test because anything you can pinch, you can suck. If you can't pinch, you can't suck it. So there are a lot of people that come in and the fat's underneath the muscle, and so we can't get that fat out from underneath the muscle. Checking for elasticity, you can see people with baggy, saggy skin. And so this is particularly troublesome for people who have had recent gastric bypass, the yo-yo diet, or they're really old and their elasticity is shot. And you can see this in for women if they've had if they have a lot of stretch marks in their abdomen, some of their elastic tissue is shot, so they're not going to have as good of a retraction. And we also want to check for hernias. So tissue types. So this is where you can determine if you're going to have good retraction or not. Young, healthy guy goes to the gym. We get rid of his love handles, retracts. You can't see that he's had the procedure. Looks like a superstar. Now this is the best case scenario. Now if I only saw people like this, guess what? Every picture would be amazing that we did because he's young, he's athletic, he eats the right diet. I'd be a superstar. We don't always get those people. Again, a young person, she's got a little bit of a loose connective tissue here. You can see it's a little bit saggy, baggy here. And after her procedure, tight, but just still a little bit of dimpling. I think this is still a compression sign, so I think she has a little bit of dimpling from that. But she has a little bit of loose connective tissue, but still great, young, good elasticity. And you can see from the side she has good retraction. We got a lot of fat out of her as well. Again, he's larger, but still, you can see his tissue is firm. This is like a week later. He's already retracted skin, looks amazing, right? So if you work on people like this, you're going to be a superstar all the time. Same thing here. You can see she's got loose elasticity, right? She's sagging here. She's a young girl, but she's probably a yo-yo dieter, and she's retracted a lot. This is going to continue to retract. She's still got the bruising, so this is within a month. So she still looks good, smooth. Here's a 55-year-old lady. She has a waddle here. After the procedure, you can see she's nice and tight, so you can get good retraction. But you have to worry about how much elasticity she has. You can see her cheeks are tight, so we don't worry too much about her with her elasticity. If she were sagging everywhere, she might not have the good connective tissue to hold it up. And from the side, you can see she had great retraction here. Arms, this is somebody who was gastric bypass patient, and guess what? If you look at her arms, she's got the bat wing thing. We got some retraction that floppy, lost a lot of weight, stretched out the skin, so it didn't retract as well as I'd like. So Aftercare Instructions, we try to review them during the consultation because if you wait until they're in the room, they're not going to understand you because they've had a little bit of Valium. The big thing is compression 24 hours a day for 2 weeks, and then 12 hours a day for an additional 2 weeks. You want to change it. We do have incision sites. We infuse Tumescent Anesthesia. The Tumescent Anesthesia is going to leak for how long, Laura? The Tumescent anesthesia out of the sites? Just a day or two, not very long at all. So we do that. You want to sleep on a shower curtain because the fluid can leak. You can have a lot of leakage. And then we want to get a little exercise as tolerated. I'm a big fan of exercise because I think it aids in the healing process. Okay, no major exertion though for a couple weeks. You can shower immediately. You want to avoid pools and hot tubs until the incision sites have healed. And we want to call the patient and check on how they're doing. Okay, here's an example. Person with great elastic tissue, really firm, just a month after, good result. Another guy, this was huge. If you'd seen him from the side, he was huge. Just liposuction a month later, transformed to good connective tissue. Again, a guy with great elasticity. He had a little bit of loose connective tissue here. Or is that a scar? I thought it was. But you can see, and you can see the minimal scars. Some people that drives them crazy, but to me, and that'll go away. And from the side, this guy, you can tell, not only did we get rid of his fat, but we got him motivated to make some lifestyle changes as well. And here, great hourglass figure after the procedure, gives you the right curves in the right spot, and this is within a month. And here, this guy was a little bit doughy and he didn't have that great a connective tissue. He's still got a good result, not as great because he doesn't exercise, no muscle tone underneath. It still looks good. From the back, it looks terrific. And again, here you can see that the women's results aren't quite as good because the connective tissue isn't quite as firm. But again, she's doughy here. After the procedure, she's got a little bit of contour irregularity, but she's still got the compression sign, so she's going to smooth out even more. So the outcome, the great thing about liposuction, why is it still so popular? Because 80% of patients are satisfied, and with cosmetic procedures, that's pretty good. 50% rate their appearance is excellent. And they're not starting out excellent, so that's great. Unfortunately, 43% of patients gain weight, so almost 50%. 75% rate the discomfort as mild to moderate, and 60% indicate that the pain lasted for 7 days or less. So, we have these new things. It was sort of a fad as opposed to a trend, and we try to be the trend as opposed to the fad. And by that I mean they're always adding new things. Like now you're hearing about the Liposonics, the Zeltig, the Zerona, and there's a couple others out there. Now Zeltig and Zerona, guess what? They came out 3 to 5 years ago, I believe. Do you hear about it very much anymore? No, because it was a fad as opposed to a trend. And I think that the Liposonics is going to be the same thing. And we here at Contour Dermatology do not want to be a fad practice. We want to be a trend practice where we're finding the best technology and we're incorporating things that actually work and are long-lasting and durable. And so, but with ultrasound and laser assisted, what they did was they controlled ultrasound energy to fragment the fat, breaking it up, leaving nerves, blood vessels, and connective tissue largely intact. And the idea was that it would melt the fat away from the connective tissue so the connective tissue could do its job and retract. And you could cause a little bit of heating, which will also cause the connective tissue to shrink a little bit. And you could only use it in the presence of a wet environment. And again, this was a fad. People did it. I tried it. It didn't really seem to make a big difference. And these were the tips. So that one disappeared. Fad, not trend. And then the Laser Lipo, this has been around for, I don't know, 5 years, 6 years. And again, the idea was it's heating inside, melting the fat, hot poker underneath the skin, basically. And this is what they look like. And the idea was you heated the blood vessels, reduced bruising. You're heating the connective tissue, improving contraction, melting the fat away, and allegedly it increased the fat removal and decreased recovery. But the big thing was it was a marketing technique. Laser lipo, laser, you've got some new technology. Fad, not trend. The real advantage, the real deal was the disadvantage, I think, outweighed it. It increased the cost and increased the risk of complications because you have a hot poker. If you're not moving that hot poker at the right rate, what's going to happen? It's going to burn. You're going to cause burns. So you're increasing your risk of complications without really increasing your risk of benefits. And so here you can see we have the Vela shape. And with this patient here, you can see dramatic improvement. The Vela shape, I like this technology because it's got 4 ways it works. It's heating the tissue through radio frequency and infrared light. And then we've got the massage and aspiration. So it's basically heating and massaging and breaking down scar tissue and fibrous bands. And so that's our cellulite device that we have. And any questions? Nope. Okay, great. Thank you, guys.